Well, Oklahoma is continually rated in the bottom when it comes to our health. In this morning's The Hot Seat, the state health commissioner breaks down what makes up those rankings and what they're doing to make positive changes.
And good morning. Welcome to Hot Seat. I'm Scott Mitchell, and this is Oklahoma's Commissioner of Health, Keith Reed. And I should say, because he won't say this, it's Colonel Keith Reed, and he served his country in Iraq before doing this and during this. Thank you for your service.
Thank you. Appreciate it, Scott. Thanks for having me.
That's great. You've got a lot of initials behind your name, which means that you know public health like few people in this state. And a lot of times the media will focus on things like rankings, and they'll focus on them out of perspective and context. You just really, when you're in public health, you just can't take anything, one thing, and extrapolate an absolute, right?
Absolutely.
And we're talking about health rankings right now. And you folks over at the Oklahoma State Department of Health are working on this for a long time. You're the commissioner there. Where are we ranked in Oklahoma in our health outcomes?
Well, that's a great question. Unfortunately, right now we're ranked 47th when you compare us to other states in the country. It hasn't always been that way. If you go all the way back to 1990, we were ranked 32nd. But unfortunately, the last 25 years or so, we've hovered in the mid-40s, a little lower, a little higher at times. From year to year, it's vacillated a little bit, but really not much progress on that front. But it's really important to understand what goes into those health rankings, because most people make the assumption that that is just about health outcomes, just about the healthcare system within the state, but it's really about far more than that. America's health rankings, which is what this number is derived from, they break up into 5 categories when they look at health. The first thing that they look at is social and economic factors within the state. So what's the economy like? What are the levels above and below the poverty line? What's the education system like? Graduation rates, looking at literacy rates. There's a lot that goes into those factors. And then you get into the physical environment. In the physical environment, we want to look at the transportation within the state. We want to look at the air, water quality within the state. We want to look at housing. These are all what we kind of refer to as social drivers of health. These are what kind of set us up in a situation where we can prosper and be healthy, or may create more challenges to being healthier compared to others.
So it's wrong for people to say, well, if we're 47th and that's the State Department of Health or doctors or teachers, there's a lot of things that make up these rankings, and it's not just one thing.
Absolutely. That's absolutely. Once you get past those first 2 groups, only then do you really start talking about the clinical aspect of healthcare. And that's where you get into clinical services and you start looking at access to care. Do we have the right amount of physicians in the state, the right specialties, the right providers? Do we have them in the right locations? And that gets to the access to care issues. That's where we look at how are we engaging in preventative services like immunizations. How about the quality of care? We look at that in that area. Then, after we look at the social drivers, we look at the clinical care, then we start to look at behaviors of the population, of individuals. Physical activity and nutrition. We look at beyond the physical activity, we're going to look at things like tobacco use, substance abuse, those type of behaviors that might lead to poor health outcomes. And then all that culminates in your health outcomes. And we look at your health outcomes. What's our prevalence of chronic diseases in the state? What are obesity rates in the state? What is the rate of premature death compared to other states?
You folks don't believe we're destined to be an unhealthy state, but we've slid back in those rankings. What can the public, what can the media, what can all of us do to help as you roll out your health improvement plan do to make this thing gain some momentum and move forward?
Well, and I'm glad you brought that up, because one of the things that I tend to come across a lot is this response that says, we're a southern state, these are our habits, this is our culture, we're always going to be ranked low when it comes to health. I just absolutely do not believe that is the case. I don't believe we're destined for that. We can there's a lot of factors that I mentioned that we can make improvements on as a state in the way of the infrastructure of the state, which I think we are making a lot of improvements in those areas. But we also have our own type of behaviors that we can look at. So being more physically active, better nutrition, avoiding those type of behaviors like tobacco use, excessive alcohol use. All those things are within our own personal control that we can modify those behaviors to produce better outcomes.
Commissioner Heath, Oklahoma State Department of Health, the health commissioner for Oklahoma. It's a big lift. I know that you folks are going to do a great job, and we'll do what we can to spread the word.
Appreciate you. Thank you very much.
Thanks for your service to our state and to our nation.
Thank you.
And thanks for watching Hot Seat. See this again at news9.com and news16.com, and follow me.